Well, welcome everyone. My name's David Ashley. I'm the Executive Director of the Western Alliance, and I'm absolutely delighted to be here on this sunny Warrnambool morning. We do know that we've had some people who'll be delayed because of, I understand there's flooding to the west of us, so hopefully everyone can make it ultimately. So firstly, I'd like to acknowledge the traditional owners of this area, past and present, the Gunditjmara people. I hope I have that correct. And this is our third symposium. It's been a great success over 3 years, the Western Alliance. We think the organisation's matured a great deal, and we're starting to better understand our progress and toward the mission, which is to improve the well-being of Victorians through research, education and training. We now have a much better handle on our research capacity. I think we're starting to ask some very important questions in our region, and we're starting to understand the approaches that we need to take to really make an impact. It is a lot of work, and it requires a long-term view. And I personally would like to thank the partners of the organisation for having that long-term view and making that investment strategically in our region. So the theme here is systems approaches to health and medical research and the health and well-being of the west of Victoria. And I think as the day unfolds, you'll see that understanding our complex systems of health and research will be critical in assembling successful programs and making an impact. And it's not trivial, it's complex, but we now, I think a number of you would have been at the workshop yesterday with Steve and others. We have the capability to understand and implement programs related to complex systems. So I'll wind up because you don't need to be seeing me. But I'd like to thank firstly the Lady Bay Resort staff. They've been fantastic, I'm told, responsive to everything we've requested. So that's been truly fantastic. The Southwest Healthcare team, Barbara Moll and her colleagues, thank you very much for the support, and all the Warrnambool crew for helping us get this going. The members of the Governing Council, there's a number of you here, and we thank you at the executive level for your support in leadership in attending the symposium today. And certainly the session chairs through the day who've made their time available, including Steve Allender, Penny Paliadalis, Francis Quirk, Lana Williams. Thank you very much. And lastly, but certainly by no means least, the Western Alliance executive team, which consists of Emma. Where's Emma? Right next to me. Hello. and Renee. They've done a fabulous job in putting the program together, and so we're very grateful. This morning we have two keynote speakers. The first of which, not just because she's my new boss that I have to suck up, but that Belinda Moyes is the Chief Executive Officer of Barwon Health. It's been a pleasure to get to know Belinda just over the brief time she's been at Barwon since July. Prior to joining Barwon Health, Belinda was the Chief Executive of the Southern Adelaide Local Healthcare Network, a very large network in South Australia, including Flinders Medical Centres, the Repat Hospital, the Noarlunga Hospital, 2 GP health centres and a super clinic, providing healthcare to a large number of folk in South Australia and a large staff. I think through that healthcare network also formed close relationships with Flinders University, and obviously has a very good handle on relationships between academics and the healthcare sector, and prosecuting important research agendas. So I think that's really important. She has an extensive experience in public, private and the rural sectors, in policy and advisory roles in government, national reform agenda, and is a professorial fellow both at Flinders University and at Deakin. I'm delighted to introduce Belinda and welcome her comments and her thoughts in making the transition to our region.
So, as the incoming chair of the Western Alliance, it's very exciting to be in the room with some really amazing researchers. It's serendipity in a way that I'm here, because in my long career in health, one of the things that I've been very passionate about is improving the system, if you like. And after more than 40 years, there's a lot of work that we've needed to do and we haven't done. And so I think we've got this wonderful opportunity at the moment, and we're perfectly poised. And today and the work that you heard yesterday is testament to that. So many of you have travelled a long way to be here today, and I believe that some have even had to navigate floods in local areas. So thank you very much for coming. As I said, my career has probably been, it's been varied, but it's been over a long time. But my observations are really, I want to share some of those observations with you, because I think these are opportunities for us. So we've invested a lot of money into hospitals, and I'm of the very strong view that hospitals aren't the main game. And we do have to shift that focus, that politicians like hospitals and beds, but they're actually not the main game. In the time that we've put a lot of money into hospitals, our chronic disease burden has grown, and we've actually got a system that's not always very well connected, and we keep reinventing structures and things. So we've now got primary health networks, which I'm very optimistic about, but we've had different iterations of that. And I suppose we've squandered time and money, and the health of the population has just deteriorated. Not only do we build lots of big hospitals, but we do harm in hospitals. And that harm is measured, and it is there, and every day that harm still stays there, like the lump under the carpet, if you like, with medication errors, falls, all sorts of things that go on, because we get busier and busier, being busy, but not actually making a difference to the health of the population, or indeed the people that we're looking after often. I think that the system hasn't joined people up, and I think that that's a really important part of this. I have, for a couple of years now, considered and conceptualised health service delivery and the health environment as an escalator. And I think one of the big was that KPMG did a bit of work about, they called it they talked about an escalator of health, something that sort of went up with the hospital at the end. I like to think of an escalator that's flat with a hospital at the end, but a whole lot of departure points along the way, so people get on that journey and have lots of opportunity to interact with lots of different players, organisations, expertise, and the very final point when they need it is the hospital. It's not the be-all and end-all. The be-all and end-all is actually the journey. And that's how I like to think about the health system. I think that we need to be much more responsive, and we are currently not responsive. We need to have different models of engagement, and that's why I'm looking very, very much looking forward to working with Jason and the Primary Health Network, because I believe that that's where we have a significant opportunity. As a leader of one of Victoria's biggest health services, I do view research as being absolutely fundamental to our business. A robust research program informs practice, attracts good people, it improves patient care, and we know that it changes the dynamic. And I like to think of, people talk about best practice and research informing best practice. I like to think about next practice, because I'm not entirely sure what best practice is. I think we know it when we see it, but I think it's a constantly evolving and moving thing. And my view is that research informs next practice and the things that we should be doing next. In trying to talk to people about research, and I have been having those conversations recently with philanthropists, it's a very difficult challenge to talk about the long journey that research often is, and getting people to invest in the longer term and being strategic, because politics isn't always strategic, and decisions about where money goes are not always strategic. And I've started to think about research as being, it's really about curiosity. And it's about fostering that curiosity, and that's a word that's in the management literature now. I know it's more than that, and I don't mean to be reductionist about your endeavour, but it is about having inquiring minds. It is about looking at the way that we deliver care and giving clinicians time to stand back and say, I don't think that worked, and that's actually not working for me, and it's not working for the patient or the consumer that I'm interacting with. So I like to think it's about curiosity, and that it needs longer term investment. And I'm also very conscious that often the people that fund and engage in this activity don't always meet the people that are excited by it. 2 or 3 weeks ago, I had the privilege of meeting with David and a number of other researchers at Barwon Health over lunch to talk about what they were doing. And I just asked them to go around the table and talk about their endeavour and what it was that they dreamed about and the work they were doing. And I walked away so excited and so proud to be part of something. And I could see the enthusiasm and the joy in the people's faces around the table. And I knew then we had something that was very precious and very special that we had to nurture and get lots of other people really interested and enthusiastic in. So in terms of attracting and retaining high-quality clinical staff, then our commitment to research and recognition of its importance is a really important thing for me. International research provides strong evidence that clinical staff have much greater job satisfaction if their work's made much more interesting and exciting when they're given an opportunity to find answers to the complex clinical questions that they have. I don't think they often get the time to ask those questions, and we have to create the time. My job's about creating the time and taking the noise out of practice so that patients benefit and we excite and enthuse researchers. So my thinking has been around the capacity and the capability, and there's been a lot of work done, but I think that needs a lot more investment and fostering. But it's also about building strong and resilient support networks and this network. And one of the things that I've learnt working over the last number of years, and I've worked in very remote communities in Arnhem Land with Indigenous communities, but the strength that we have as a rural region is very important. And we must nurture that, and we should be connecting. The health of the people in rural areas isn't good, we know that, and we have a real opportunity to make that better. And I think as the health system and health structures evolve, our small hospitals that have fulfilled a role in small rural areas are threatened. And so we have to make them much more contemporary organisations to the needs of the local community. And I did this journey in South Australia because when I first went over there, I was running all the rural hospitals, and there were 68 of them, I think. And I did a bit of a tour all around South Australia talking to rural communities around their expectations of their health services. And it seemed to me that there was a lot more we could do to make them much more contemporary. And so your work, research, will inform what our structures look like. And I think there's a real opportunity to do something quite significant here. I'm delighted to see that the keynote address today is on chronic disease prevention. It's a topic in which I have a very keen interest. I firmly believe that we need to look very carefully at how we keep consumers well and out of hospital. I don't want my 85-year-old mother in Melbourne to be going into hospital. I'd much rather she was at home, having the support services around her. To do this, we need to apply an innovative lens to chronic disease research. And for the future, I see an increased focus on integrating chronic disease research into clinical practice and working collaboratively across disciplines to break down the barriers to achieve an improved rural and regional population health outcomes in the future. The theme of this year's symposium is systems thinking and innovation in healthcare. I'm told on good authority that the inspiration for this theme was one of last year's keynote speakers, Professor Steve Belinda, who we're very proud to acknowledge as a world leader in both obesity prevention and systems thinking. Steve began the conversation yesterday, I believe, with his excellent workshop on how to use systems thinking for collective impact. I understand that some 30 or so people who attended that workshop are sitting here all fired up, inspired and ready to go. So I hope that spark of inspiration is passed on to everybody here. Thank you, Steve. In addition to hearing from one of our learned speakers, I invite you to enjoy this opportunity to meet with and get to know colleagues from other parts of Western Victorian region. collaboration, and indeed future collaboration, is built and nurtured by these personal connections. I wish you well and all the very best for your successful symposium. Thank you.